My name is Michael Geary. I've been with South Shore Orthopedics here now for 5 years. I'm originally from Connecticut, but I did my undergrad here in Massachusetts at Holy Cross and then went on to med school at the University of Connecticut. I did my postgraduate training at Boston Medical Center and then did a year of additional fellowship training in sports medicine and arthroscopy at the Southern California Orthopedic Institute in Los Angeles. I think of all the surgical fields, it's one where you can really have a concrete impact on a patient's quality of life. The diagnoses usually are pretty concrete, and they oftentimes can be corrected or significantly improved, and that can have a dramatic effect on a person's quality of life, and that's something that just drew me to the field. I always start by, giving them the opportunity to tell their story and to not interrupt them. Most of the time you can tell what's wrong with the patient based on their history, and so I give them ample time to kind of tell me what's been going on and try and keep a positive attitude and let them know not to despair, that usually we can get people feeling better and most of the time resolve their problem pretty effectively. The most rewarding thing is when you run into your patients and they're people that you know and live with, and you've been able to help them out with whatever orthopedic problem or complaint they have. Sometimes it's just education, other times it's surgery to help them get better. I think this building is top-notch. It really enables us to provide all aspects of musculoskeletal care, from diagnosis, imaging, whether it be X-rays, MRI. Office visits here, and then if surgery is necessary, we have our surgical center up on the second floor, or if it's just physical therapy, we have our physical therapy up on the third floor. So really we can provide pretty much all the musculoskeletal care they need right here in this building, which is great for both the patient and for us also, actually. There's just lots of things we can do to help individuals in chronic pain and with joint pain, and oftentimes it can just be education can help. That's kind of the simplest thing we do, just to educate patients about their problem. And sometimes there's not a surgical solution. In fact, most of the patients we see in the office, don't need surgery, and whether they just need some education or therapy. But most of the time we can get patients better, and at the very least we can educate them about their problem. I think diagnosing a problem that can be corrected through surgery, doing the surgery, and getting the patient back to their baseline level of function, that's a great feeling, and that's really what I enjoy most about orthopedics.